We are often asked, what do I do when the child has challenging behaviors? What's the best way to react? I start by saying, first and foremost, the majority of the time and effort that you put into challenging behaviors needs to come on the front end. So it first needs to start by the preventative strategies, thinking about what skills they need to learn, thinking about what kind of modifications you need to make in order to prevent the challenging behavior from happening. But when it does happen, it's very important how you react. So first thing first is give as little attention possible to the behavior. So not using a lot of verbal and as little physical as you need, just enough to keep you and the student safe. So not talking to a student. I always tell people that nobody has ever talked somebody out of a meltdown. If I'm frustrated and mad, I don't want somebody to try to talk me through it. Okay, so think about that for your students, like not trying to talk them out of it. And this can be really hard for some people, is to keep their mouths shut. The other thing is to limit your physical. So a lot of kids we know with challenging behavior have sensory issues, and so touch, when you're touching them, when you're putting your hands on them, can only escalate the behavior. The other thing is to, if you are going to communicate with the child, write it down. Just use a simple first then, or if it says first sit in your chair, then you can have access to maybe what they were wanting or to something else. You can try redirecting, but usually when you're at the height of the meltdown, your first job is to just get them calm. You might have to have the other students, if you're in a classroom, leave the room. I've also had parents have to actually leave the room. At that point in time, you usually cannot move the child, and I wouldn't recommend that you do. So you might have to remove yourself, especially if the child or the student is coming after you. So once this child is starting to de-escalate, you can start putting more supports back into place. But at the time, the height of the meltdown, your goal is just to get them out of the meltdown by not talking to them, walking away, you staying calm in order to try to get them back down again. Remembering that when they're at that height of the meltdown, when they're at that point, this is not a learning time. You're not going to talk them out of a meltdown. You're not trying to teach them anything, because most likely they won't even remember what happens during that time. You just want to make sure that the environment stays safe for the child, for you, and for anybody else around. Little attention, and start letting the child de-escalate. While you're going through this process, though, start thinking really closely about what was it that got the child there? What could you change about this the next time? Were you pushing too hard? Was he wanting something that he couldn't access, and so he didn't have a way to tell you that? So was it communication related? Do we need to implement more breaks throughout his day? Is he using this as a way to just get a break? So thinking about all those things as the child is de-escalating, so that way the next go around you can avoid this the next go around. So just to recap, when the child is at their heightened point and they're having the meltdown, stop talking, get visual, and then redirect back to whatever task it was, and you might have to modify that task as soon as they start to de-escalate. Thank you. Have a great day.